Introduction to Energy Medicine. This video is property of Ravzur. Core Concepts and Foundations. What is energy medicine? Energy medicine is a branch of alternative and complementary medicine based on the belief that the body is not just a physical structure, but also a complex system of energies. The central premise is that illness is caused by disturbances in the body's energy flow, and healing occurs when this flow is restored. The two types of energy fields. The National Center for Complementary and Integrative Health, NCCIH, historically classifies energy medicine into two categories. Feature, veritable energy fields, putative, subtle, energy fields. Definition, measurable energies that follow the laws of physics. Unmeasurable energies, by current standard technology, believed to be vital life force. Examples, magnetic fields, sound waves, light, electricity, chi, TCM, prana, Ayurveda, mana, biofield. Therapies, MRI, radiation therapy, UV light therapy, PEMF, pulsed electromagnetic field therapy. Reiki, healing touch, Qigong, intercessory prayer. Anatomy of the energy body. Traditional frameworks map the subtle body using specific structures that process life force. 1. The biofield, the aura. The biofield is described as a torus-shaped electromagnetic field that surrounds the human body. Function. It is believed to act as a protective shield and a filter for information from the environment. Scientific correlation. The heart generates a measurable electromagnetic field that extends several feet from the body, detectable by magnetometers, squids. 2. The meridians, the pathways. Originating in traditional Chinese medicine, TCM, meridians are channels through which qi, vital energy, flows. Analogy. If the body is a city, meridians are the highway system delivering supplies, energy, to every neighborhood, organ. Key fact, there are 12 primary meridians linked to specific organ systems, e.g., lung meridian, heart meridian. Blockages here are treated with acupuncture. 3. The chakras, the centers. Originating in Ayurvedic tradition, chakras, Sanskrit for wheel, are spinning vortices of energy located along the central channel of the spine. Root, Muladhara, base of spine, red, survival, grounding, safety. Sacral, Svadhisthana, below navel, orange, creativity, sexuality, emotions. Solar plexus, Manipura. Stomach area, yellow, willpower, self-esteem. Heart, Anahata. Center of chest, green, love, compassion, connection. Throat, Vishuddha. Throat, blue, communication, truth. Third eye, Ajna. Forehead, indigo, intuition, insight. Crown, Sahasrara. Top of head, violet, spiritual connection, consciousness. Major modalities and techniques. 1. Acupuncture and acupressure basis, TCM and meridians. Status. Widely accepted for pain management. WHO recognizes its efficacy for numerous conditions. 2. Reiki basis, Japanese universal life energy. Method. The practitioner places hands lightly on or just above the patient. They act as a conduit for energy to flow into the patient to support the patient's own healing response. Key concept. It is passive. The practitioner does not manipulate the energy, but channels it. 3. Qigong and Tai Chi basis, Chinese internal martial arts. Method. A combination of movement, meditation, and breath regulation to cultivate and balance qi within one's own body. Benefit. Often prescribed for balance, stress reduction, and cardiovascular health. The scientific perspective. It is crucial to approach energy medicine with critical thinking. The evidence gap. While veritable therapies, like light therapy, are scientifically proven, putative therapies, like Reiki, often struggle to demonstrate efficacy in clinical trials beyond the placebo effect. Critique. Instruments cannot currently detect ki or prana. Counter-argument. Proponents argue that the lack of proof is due to the lack of sensitive enough technology, not the absence of the phenomenon. The placebo effect. Many scientists believe the benefits of energy medicine stem from the placebo effect, the patient's belief in the cure, and the relaxation response, physiological changes that occur when the body is deeply relaxed, rather than an actual transfer of energy. The biofield hypothesis. Recent research in bioelectromagnetics explores if the body's weak electromagnetic fields, generated by the heart and brain, process information. Some researchers hypothesize that energy healers may be entraining their heart rhythms with the patient to induce relaxation. HeartMath Institute. Try this simple exercise to experience what practitioners call energy sensation. Rub your hands. Rub your palms together vigorously for 15 seconds until they feel hot. Separate. Hold your palms facing each other, about 2 inches apart. Do not touch. Pulse. Slowly move your hands apart, 6 inches, and bring them back close, 2 inches, in a rhythmic motion. Observe. Focus on the space between your palms. Do you feel heat, tingling, magnetic resistance, or a cushion of air? Conclusion. Whether this is simple heat radiation, blood flow, or ki, this sensation is the foundational awareness used in energy medicine. Mechanisms and practical applications. Prerequisites. Completion of Module 1, Introduction to Energy Medicine. Focus. The intersection of biology and physics, and actionable techniques for self-care. The Living Matrix. How energy moves physically. One of the biggest questions in energy medicine is, how does information travel faster than nerve impulses? 1. The fascial network and piezoelectricity standard anatomy focuses on nerves and blood vessels. However, energy medicine researchers, like Dr. James Oshman, look at fascia, the connective tissue wrapping every muscle and organ. Crystalline structure. Connective tissue is liquid crystalline in nature. The piezoelectric effect. When you apply pressure, massage, acupuncture, movement to a crystal, it generates an electric charge. Theory. When an acupuncturist needles a point or a massage therapist stretches fascia, it creates a piezoelectric signal that travels instantly through the body's connective tissue too. Quantum entanglement. Non-local healing. Concept. In quantum physics, entangled particles remain connected so that actions performed on one affect the other, regardless of distance. Application. Proponents suggest that intention acts as a bridge, allowing a practitioner to affect a patient's biofield without physical proximity. Note: this is highly theoretical and debated in the scientific community. Expanded modalities, sound and vibration. Everything in the universe vibrates at a specific frequency. Illness is often described in this field as dissonance or being out of tune. Sound healing, using vocal toning, tuning forks, or singing bowls to restore harmonic resonance. Entrainment. The principle where a stronger rhythm causes a weaker rhythm to synchronize with it. A slow, steady drum beat can entrain a chaotic heart rate to slow down. Binaural beats. Playing two slightly different frequencies in each ear, e.g., 200 Hz and 205 Hz, to force the brain to align with the difference. 5 Hz, theta state, promoting deep meditation. Crystal therapy. Premise: crystals, specifically quartz, have a stable, unchanging frequency due to their perfect geometric lattice. Mechanism: based on the piezoelectric effect, used in watches and radios. Proponents believe holding crystals can stabilize the fluctuating, chaotic energy field of a stressed human. Practical technique: emotional freedom technique, EFT, also known as tapping. This is a psychological acupressure tool you can teach clients. The concept: combining cognitive reframing, talk therapy, with physical stimulation of meridian endpoints. The protocol: 1. Identify the issue, e.g., I am anxious about this exam. 2. Rate the intensity, 0 to 10. 3. The setup: tap the karate chop point on the side of the hand while saying, even though I have this anxiety, I deeply and completely accept myself. 4. The sequence: tap 5 to 7 times on each of the following points while repeating a reminder phrase, e.g., this anxiety. Top of head, eyebrow, beginning of brow, side of eye, under nose, chin, collarbone, underarm. 5. Reassess, rate the intensity again. Energy hygiene, daily best practices. Just as you brush your teeth, dental hygiene, this field suggests maintaining energetic hygiene to prevent burnout. 1. Grounding, earthing. The science: the Earth's surface has a limitless supply of free electrons, negative charge. The human body builds up positive charge, free radicals, inflammation, from stress and electronics. The practice: walking barefoot on grass, sand, or soil allows a transfer of electrons from the earth to the body, theoretically neutralizing free radicals. Action: 10 minutes of barefoot contact daily. 2. The zip-up, protective visualization. Origin: Donna Eden Energy Medicine. Purpose: to protect against taking on other people's stress or negative emotions. Technique: 1. Place hands at the pubic bone. 2. Inhale deeply while tracing a line straight up the center of your body to your lower lip. 3. Lock it at the top. Imaginary key. Interpretation: this traces the central meridian, theoretically strengthening your boundaries. Safety and ethics in energy medicine. The danger of either-or. Energy medicine should be complementary, not alternative. Red flag: a practitioner telling a patient to stop chemotherapy or insulin in favor of energy work. Correct approach: using energy work to manage the side effects of chemotherapy, nausea, fatigue, while the medical treatment fights the disease. The healing crisis. Explanation: this is often attributed to the release of stored toxins or metabolic waste into the bloodstream faster than the system can eliminate them. Management: hydration and rest.